And welcome back. It's 9:16 on a Monday morning. September, the whole month, Suicide Awareness Month. And a time to remember those affected by suicide, to raise awareness and connect individuals to treatment services. Suicide is the second leading cause of death in people ages 10 to 24, and those rates are increasing. Here to share more about what Spectrum Health is doing to help prevent suicide, Kathy Larson. She's a nurse practitioner for behavioral health medicine at Spectrum Health West Michigan. Good morning. How are you?
Hi, I'm good. How are you?
I'm well. Thank you so much for asking. I just shared one of those stats that spoke to how much suicide affects people. I'm sure you've got a few more startling numbers out there.
Yeah, absolutely. So suicide touches many lives and families. As you said, it's one of the leading cause of death among young adults, but not just young adults. It's actually the 10th leading cause of death among adults of all ages in the United States. So suicidal thoughts, they can be very prevalent and they can be very dangerous. They're actually considered a psychiatric emergency. So it's really important to know the warning signs and to seek help right away.
And those warning signs that you just mentioned, what can we look for? I mean, I'm sure that anyone who has suffered through this, who has had a friend or a family member lost to suicide, must be wondering, what could I have done?
Yeah, so there are a lot of red flags to keep an eye out for. One might be a loved one talking about feeling hopeless, feeling like a burden. Sometimes they might talk about suicide directly or indirectly. An indirect comment might sound like, I wish I wasn't here anymore, or I wish I didn't exist. They might also socially withdraw from normal activities, from family, from friends. They also might act like they're saying goodbye forever. They might give away their personal possessions, and also sometimes they can engage in impulsive or dangerous behavior.
Out of all those signs, if someone watching now sees that in a loved one or a friend, how would they start a conversation? How would they talk to that person? Would they call someone else? What's the first step?
Yeah, absolutely. So if you suspect that somebody is considering suicide, I recommend addressing the person. For example, you can start the conversation by talking about the warning signs you've noticed. You can say something like, I noticed you've been more withdrawn and you've been talking about feeling hopeless on your social media. Then, second, I would ask about the thoughts directly. Are you thinking about suicide? Are you thinking about hurting yourself? Do you have a plan? If the answer is yes, let them know that you're concerned about them and that you want to help. And I recommend seeking help right away and staying with your loved one until you get further guidance from a professional, whether that's staying with them in person or on the phone.
Yeah, we got this great acronym up on the screen right now, the acronym for SAFE, which you just mentioned is to stay with that person and
hmm
access help via that hotline. But validating those feelings might be one of the key things.
hmm
I hear
Exactly. And then eliminating risk as well. So that's if there's maybe any dangerous items around, any
Okay.
weapons, getting those out of the environment.
Absolutely. Anything what they might use to harm themselves. Where can people seek help? There's a number people can call, I'm sure, a website. Where can people go?
Yeah, there are many different ways to seek help. You can always seek help from a healthcare worker, whether that's your primary care provider, your family doctor, a social worker, a nurse, or another healthcare provider. They should be able to assess your concerns and point you in the direction of the next steps. But also, if you're like, I'm not sure who to call or where to go next, you can call a crisis hotline. The National Suicide Prevention Hotline is 1 800 273 TALK. You can also go to your local hospital, your local psychiatric urgent care, or you can always call 911 and ask for someone with mental health experience. They often have a mental health crisis team available. But if you're looking for more resources, you can also check out Spectrum Health online at spectrumhealth.org/suicide prevention. And if you're feeling suicidal, I just want you to know that you're not alone in this feeling. You don't have to go through this alone. There's a world of trained professionals who want to help you, so please seek help right away.
Kathy, great information this morning. Thank you so much.
Yeah, my pleasure. Thank you so much.
You bet. Have a good one. Hey, that
You too.
is great information right there. If you or someone you know is going through this, the National Suicide Prevention Hotline, 1-800-273-TALK. That's 273-8255. And if you're looking for more resources, you can also check out Spectrum Health online at spectrumhealth.org/suicide-prevention. We'll be right back.